Hi, I'd like today to talk about environmental pharmacology and our UFAR project, which could change radically the doses of pesticides that we put into the environment. If it gets accepted, we're building up a network of allies to be able to see how we can get this accepted worldwide. Effectively, what we are doing is that, what we want to do particularly, is that we want to have KIs at the site of action for the pesticides to be in a database so we can compare them with the concentrations in the environment. So we can see how active the drugs are at their site of action in insects or pests, bystander species such as earthworms and other pests or other insects, and also humans. The doses that are being used are massive. This is 70 million kilos of pesticide in the UK, 4.1 million tons worldwide or more. And that gives 220 grams a hectare, 22 applications, a chemical load of about 0.5 grams per square meter, which is enormous for poisons. Imagine that on your dinner table. And there are also multiple chemicals, and the synergies are never looked at. And we need precise IC50s, KIs at the site of action, which we then compare with the concentrations which are present in the environment, in soil, lakes, drinking water, etc. These are beginning to accumulate massively. So it's fairly simple. So Chris Connolly, Steve Alexander, and Jamie Davis from NCI UFAR, and myself wrote an article on dosing the environment, whereby the level and frequency of dosing is critical, and a simple way forward would be just to look at the pharmacology rather than the toxicology, because the LD50s are usually massively above the KIs for the interaction of a pesticide with its site of action. And there are many parallels between mammalian and environmental, mammalian farmed environments for aphids, beetles, etc. And so we can make parallels with how we treat drugs, and drugs that are tightly regulated. And quite frankly, I believe that the pesticides should be regulated in a very similar way for doses for effectiveness. And so crop life is an accumulation of the 5 largest agrochemical companies, and their agents are well defined, and the doses that we use in the world are well defined. So we can look at the dose per country, and that relates, then we need to know where the sites of action. The sites of action are actually defined by crop life, and you can see that these fungicides, triazoles, which can also interact with 6-8 dehydrogenase, are quite drug-like in their structures. And the 6-8 dehydrogenase inhibition has been compared by Pierre Rustin, and there is very little selectivity between insect and mammalian and human 6-8 dehydrogenase, which is a critical enzyme in Krebs cycle, and inhibitors produce more free radicals. And Rustin claimed that this would give a mechanistic approach for also increasing neurodegenerative disorders. So there is very little margin for safety in terms of their potencies at the various sites of action. So there are many possibilities for sites of action for different herbicides, etc. But these are all have been shown by crop life, but what they don't show are the KIs. Sometimes EC50s, but EC50s, as you know, depend upon the experimental conditions. The nicotinic neonicotinoids can have affinities of just a nanomolar, a single nanomolar, showing how potent they are. And we've been obviously able to characterize some of the toxic effects, which can be quite massive on the environment. Another area which is not looked at all are the critical nodes, whereby deletion of a particular node causes fragmentation of a network. It's a major effect on biological systems. And if you look at the opposite effect for synergies in medicine, I take an ACE inhibitor, beta-1 receptor antagonist, and aspirin, at extremely low doses, but it's got major effect on my cardiovascular system. And so these synergies are not looked at all. And the current regulatory guidelines, it's true that mixture risk assessment is not yet available for the environment. And that means that these synergies and the critical nodes are just not assessed, despite massive doses in soil. So we therefore consider that the concentrations which interfere with function may be 100-fold lower than concentrations causing toxicity. This is particularly true for, say, neonicotinoids, which can affect bee behavior at 100-fold less dose than causes LD50, which is what the regulatory bodies take into account. And so we think that a simple database of KIs for site of action on pests, bystander species, and humans will establish therapeutic ratios, which would probably reduce the total dose of pesticides by possibly 100-fold, if not more. So we had this article published, and it was interesting. The referee said that this piece is a great starting point for an important global conversation. We're starting that global conversation. We've had a meeting at the International Science Council with IUTOX and the other unions, international unions, who are interested in producing a position paper. And so this is something which I think is a considerable growth area for pharmacology. It's relatively simple to do. We would love to have a CRO which would actually measure the different targets, and for that, the budget required for a worldwide effect would not be major, and at the same time, it would give us an enormous amount of information about how toxic these pesticides are. So that's the project, and I'd be very willing to discuss it within this meeting or in subsequent meetings. Thank you very much for your attention, and I think it's a good way forward for pharmacology in the future.